Hi, this is Shane, your respiratory practitioner with Rocky Mountain Respiratory Resource. We're here at a facility and we're going to be showing you how to properly suction an airway and possibly with this gentleman a difficult airway. So what we're going to do first is we're going to gather our gear. We have him set up on a room air trach mask, which he's doing really well at 92%. Whenever you're suctioning the airway, we want to have a pulse ox on them, especially if we don't know them. If we know them and we've been working with them for a while and we know that they do not deoxygenate or desat when we're suctioning, then we don't have to put a pulse ox on them. So we know him well, but for demonstration purposes, we're going to show you during this process how we watch the heart rate and the O2 saturation. So we gather our gear. I have my suction here. It's on. I'm going to bring it around and get it set up. I have my ambu bag ready in case I need it. I'm not planning on using it, but if I do need it, I have it ready. And then we're going to pull out our suction catheter. Now, we're in a skilled nursing facility, not in the hospital, so we're going to do this by ourselves. Any skilled nursing facility nurse knows that she will be alone in here doing the suctioning. At the hospital, as you know, there's always two of us, especially in the units. But here, there's just one of us. So you have to pick a sterile hand. I'm left-handed, so I will always use my left-handed to remain sterile. So you're going to don your sterile gloves. They're not super easy, like surgical gloves are. So here we are. I'm left-handed. This is going to be my sterile hand. This hand I'm going to use to lavage, if I need to lavage, although I'm going to show you, okay? I'm going to hook up my suction. All right, Carl, we're going to go into your airway now. I'm pulling the trach mask back, and I'm gently going into the airway, and now I'm stuck. Okay, it's hard to make the bend here because of his malacia. So I pull the trach out a few millimeters, continue to work it in, and now we're down deep into the chest. I'm pulling vacuum, coming out slowly, not staying in the airway longer than 10 seconds. Okay? And then we're going to let him catch his breath. What you notice is the SAT, even on this room air setup that we have, is still 88 to 92%. Heart rate has come up a little bit from 71 to 90, but he's very calm, he's relaxed. Now he does have some thick mucus. So this pass, we're going to add a little bit of saline. And I know nursing students now are saying no saline, but you have to have saline. It helps to lubricate the catheter, it helps to change the salinity within the chest. Bacteria does not like saline. And it makes the sputum a lot thinner. So here we go. Watch your face back there, ladies. We do have some other folks here, speech therapy and nursing in the room. So Carl, take a deep breath in for me. Deep breath in. Okay, we'll try to get him to breathe it in. I'm going down, and I'm stuck again. Pull the trach out, and I'm in. This would be the first trach in 35 years that I've had to pull out that far, but it's because he shells because he has severe malacia. So in this situation, we just can't not suction. We have to do whatever technique is required to be able to get into the chest to get this mucus out. As you know, if we leave the mucus in there, it becomes infected, and all of a sudden we're fighting a pneumonitis. How does that feel? You can always put your hand on the chest. When we started, we didn't hear any rhonchi when we listened, and we didn't feel any tactile fremitus at first, and we still don't. But since we do know him, and he's been here with us a while, we know that he does have a lot of mucus. And he does have a difficult airway, but that's not going to stop us from getting in. Deep breaths. Now, if I still had tenacious thick mucus, the next step is to employ the ambu bag. So in order to, I'm done with the suction, so let's pretend like I'm not. We'll put it right back here. Get rid of our catheter real quick. So if he had thick mucus, I will put the saline bullet in here, the ambu bag right on the trach, Give a couple of big squeezes with both hands for an 800 to 1000 cc tidal volume, and then suction. And what that does is it creates turbulence. And also when I put pressure behind my saline, it causes the saline to distally, at the end of the trach, fan out and drop evenly into both lung fields, allowing great turbulence, which is what we want. We want to stir them up. It's like a high-frequency vest, or in the old days when we clapped with hands, moving that mucus, unclinging it from the chest wall, moving it to the center so that he can either cough it up or we can go get it. All right, remember, for now we're wearing masks. If you have COVID-positive patients, face shield, headgear, gloves, wash your hands before and after. Thank you so much for taking the time to watch this video. Call us with questions or concerns at 303-507-1565. Thanks again from Rocky Mountain Respiratory Resource.